Today we're going to be talking about a very important part of healthcare, and that is how we prevent the transmission of disease in a healthcare setting, a hospital or a clinic, from patient to patient. One of the most dangerous areas for transmitting disease is using reusable instruments that may have been contaminated with blood or bodily fluid. We're going to look at how we can clean these instruments appropriately to prevent transmission of disease. One of the things we're going to talk about in this video is the Joint Commission standards that we have to follow and what Joint Commission surveyors may ask you about transmission of disease. But remember, the point of this is not just to get the right answer. Our purpose is to clean instruments appropriately to protect our patients from disease. Instruments need a pre-cleaning after they have blood or bodily fluid on them, and then they're going to have special processing in order to sterilize them. The pre-cleaning part is a very important part because if they are not appropriately cleaned, sterilization will not protect patients from the transmission of disease. We're going to go through a series of questions you may be asked, a series of procedures you need to do just to make sure that we are appropriately protecting our patients.
Hi, my name is Rosalinda Neri. I'm one of the nurses here in A4D Ophthalmology Clinic. Today, I'm going to give demonstration on how to clean reusable instruments in accordance to LAC USC Medical Center Nursing Policy 625 and also found as an addendum in Unit Structure Standard for all units in ambulatory department. Here are the equipments and supplies we need in cleaning reusable instruments. Gown, safety glasses, face shield, and gloves. Disposable basin, disposable brush, hospital-approved detergent which is Prolistica 2 times concentrate, AccuSync dosing system. For clinic areas that do not have the AccuSync dosing system, we can use measuring cup. The manufacturer recommended ratio of the solution is 15 ml of Prolistica 2 times concentrate to 4 quarts or 1 gallon of lukewarm water with temperature between 90 to 120 degrees Fahrenheit. Timer, additional basins, biohazard bin, also known as biobin. Prior to cleaning instruments, staff has to put on the PPE, starting with the gown, followed by face shield, and then gloves, covering the wrist of the gown. Make sure that there are no exposed skin surfaces. To begin the process, we're gonna clean the dirty instruments under the cold running tap water to remove debris and gross contaminants. Open it, clean it under cold running water to remove contaminants, debris. Individually. Okay. Since this is also dirty, we're gonna also clean this one. We're gonna prepare the solution by filling in the basin with 4 quarts or 1 gallon of lukewarm water. So ensure that the tip of the dosing system is immersed in the water. To ensure the correct water temperature, between 90 to 120 degrees Fahrenheit, and then dispense the Prolistica 2% concentrate by pressing the green button. After dispensing, then put this beside the sink. Now that our cleaning solution is ready, we can now soak our instruments in the solution. With the use of our timer, we are going to soak these instruments for 5 minutes. After soaking the instruments for 5 minutes, with the use of disposable brush, we are going to brush each instrument one by one, removing any remaining debris or gross contaminants. After brushing all the instruments, we can discard the solution in the sink, either daily or whenever visibly soiled, whichever is sooner. Since we use disposable basin and brush, make sure to dump them after use in the regular trash. Now we have to rinse the instruments with clear water to remove soap residue, since it can cause discoloration and pitting of instrument surfaces. After rinsing, place the instruments on a bio bin to air dry. Some clinic areas place their instruments on a lint-free cloth to air dry prior to placing them in a bio bin.
Good morning. My name is Victoria, and I'm going to be asking a few questions regarding the process for cleaning instruments. What should be the water temperature?
90 to 120 degrees Fahrenheit.
And how do you know that the temperature is correct?
No blinking at the LCD temperature screen of the AccuSync dosing system.
What do you do if the water is not the correct temperature?
Let the water run till it reaches the ideal temperature of 90 to 120 degrees Fahrenheit.
What type of solution do you use to clean the instruments?
Prolistica 2 times concentrate.
And how do you know whether it's the correct amount?
With the AccuSync dosing system, we will just press the green button and it will automatically dispense the right amount. For those clinics who don't have the AccuSync dosing system, we can use the measuring cup. And it would be, the ratio would be like 15 ml to 4 quarts or 1 gallon of lukewarm water.
How much time should the instruments soak?
The instruments will be soaked for 5 minutes.
And what do you use to scrub the instruments?
Disposable scrub brush.
Why do you need to scrub the instruments?
To remove the debris and the gross contaminants.
If you need to find the manufacturer's recommendations, where would you go find them?
At the label of the solution.
How is the staff trained?
In service or video.
Where can evidence of training be found?
Employees file.
How are instruments transported to Central Sterile?
By the use of the biohazard bin or the bio bin.
Is the use of PPE routine when you clean the instruments?
Yes.
Where can the process for cleaning the instruments be found?
Nursing Policy 625 and addendum to the unit structure standard.